Good afternoon. Thanks, Clint. Let me begin by quoting the Economist magazine of 1st of June this year, and I'll paraphrase. Healthcare in Northern Ireland is a disaster. That is a warning to the rest of Britain. The Royal College of Emergency Medicine says that there are 3 times as many deaths due to emergency department delays in 2022 as died in the worst year of the Troubles. That's treble. I'll be using multiples today. Percentages don't do it anymore. People love an NHS that no longer exists, The Economist says. The 2 main parties have not laid out plans commensurate with the scale and nature of the problems. It's bad when The Economist notices you, and unedifying when they say that our NHS is a disaster. This is despite the hard work of all the healthcare workers in Northern Ireland. And if my speech comes across as angry today, I'm representing the feeling of the healthcare workers and indeed the patients. Just to be clear, I'm speaking in a personal capacity because the BMA wouldn't let me read this speech. Question: how bad is the NHS in UK in general and Northern Ireland in particular? Wes Streeting says the NHS is broken. We said that 2 years ago. Indeed, it has reached the lowest ever satisfaction rating of 24%. Robin Swan, our recent health minister, used words such as catastrophic impacts, patients coming to harm, and the need for damage limitation. There's been a 218% increase in private healthcare in Northern Ireland in the last 4 years, double in the last 2 years, and Kingsbridge Private Hospital Group tells us they do more total hips and more total knees than all the NHS hospitals in Northern Ireland combined. GP funding is 5.4% of the total health spend. It's that bad. Question: why is it so bad? 3 main reasons. There are many, but 3 main reasons. Underfunding. There's a 15% deficit in the health service, 32 billion for the UK, 1 billion for Northern Ireland. This is due to Tory austerity. Let's put the blame where it belongs, and Tory austerity has done this. There's an allegory of the scorpion getting a lift across the river from a frog and stings it on the way over because it couldn't help itself. The Tories are the scorpion. The NHS is the frog, and they just can't help themselves. When they're in power, they look to destroy the health service, and have done a worse job this time than they've ever done before. So underfunding is our biggest problem. The next problem is understaffing. The UK has a lower number of doctors, lower than average nurses. We have the lowest number of CT scanners and MRI in the Western world. We've closed half our hospital beds in the last 30 years. How are we supposed to cope with that? How are the staff and the patients supposed to cope with that? France has twice as many beds, Germany 3 times as many, Japan 4 times as many hospital beds as we have. The third main reason then is overwhelming workload and the waiting lists. And Northern Ireland has the worst waiting lists of the 5 countries in the islands. Now, we could compare ourselves to the other 3 in the UK, but let's compare ourselves to the Republic of Ireland, who have the best waiting lists. I know our friends, our cousins in Dublin say it's an awful health service. It's the best in the islands. In terms of the waiting lists, our outpatient waiting lists are double the Republic of Ireland, but when you look at those waiting more than 12 months, we're quadruple. Our inpatient waiting lists are 3 times the Republic of Ireland, but when you look at the waiting lists greater than 12 months, they're undecouple. That word means times 11. I had to look that up on Google. I didn't know there was such a word as 11 times. Undecouple. That really tells us where we are here in Northern Ireland. So why have we all these problems in Northern Ireland? Combination of reasons. Delayed transformation. We could do that in detail. No multi-year budgets. We've heard that from our politicians. Inadequate funding from Westminster. And also we have less private spend in Northern Ireland. In England, 20% of healthcare is through private. We have very low levels here. But our biggest risk by far, and it's a sort of backhanded compliment, is Sláinte Care. Sláinte Care is putting huge amount of funding and staff and infrastructure and everything into the Republic of Ireland. Much better terms and conditions for healthcare workers. Doctors will get double, but it's not just doctors, it's doctors and nurses and physios and OTs and podiatrists and radiographers all moving across the border, and we have a particular problem with our consultant colleagues moving across the border for more than twice the pay. We've also had no revenue-raising measures from Stormont Executive. And I'm serious about this. If Westminster don't pay, then we have to pay ourselves. We are grown-ups. We should be funding this ourselves. But the biggest problem, and I want to really emphasise this today, is cancer services. Cancer patients have a target of getting treatment within 62 days. We're achieving 30% in Northern Ireland. 70% of cancer patients aren't reaching treatment within 62 days. That's appalling. We should be ashamed of that. As a result, we're seeing huge numbers of late presentations of advanced metastatic cancer where no primary cancer has been identified and the patient dies too quickly to identify the primary. Dairy people always have a metaphorical allusion for things. They now call this new disease riddled with it. Why is Jimmy in hospital? He's riddled. Shameful. Every month's delay with a cancer diagnosis increases mortality by 10%. So to summarise the situation in Northern Ireland, we can't fix these waiting lists. They're too big. You can see them from outer space, and they will get longer. I'm the guy that has done healthcare in a leadership position for 30 years, and what I'm saying here is my opinion, but this is what's going to happen. So we can't fix these. We have no hope of competing with Sláinte Care. We are East Germany, they're West Germany. We have no hope of increased funding from the UK. Even when the Labour Party get in, they will not find funding for the first 3 or 4 years. And that's down to Brexit, as we've heard. We have no hope of local politicians recognising the problem and taking action. That's a little gloomy, but that would be my reading of the situation at the moment. We have a collusion of anonymity with the public, the politicians, the media, and I'm blaming them as well because they've not been on their game in this instance. And the budget, I think the media let us down when the Stormont budget came out. So collusion of anonymity with the public, the politicians, the media and those in authority refusing to recognise the disaster that is in the NHS in Northern Ireland. The BMA keeps being told, don't be so pessimistic, find something positive to say. Seriously? What can we do? We need to stop pretending that we have a universal health service. We don't, it isn't. That's gone. But there's only one thing worse than an absent service, and that's a pretend service. And that's what we're doing at the moment. Many of my patients would rather die at home, and I'm talking 2 or 3 per week. Many of my patients would rather die at home than go to Altnagelin ED. And Altnagelin is a wonderful hospital with really hard-working staff, but they are overwhelmed. A very difficult place to work now, as are all the hospitals in Northern Ireland. We have waiting lists now that are longer than the life expectancy of the patients on those waiting lists. We have ambulance waiting times which are longer than the life expectancy of critically ill patients. And we have GP practices closing in their droves because they can't cope on 5.4% of the budget. And pharmacists and dentists, and we know what's happening. And just to give you an insight, England's much better than us in terms of hospital service, but actually much worse than us in terms of general practice. They are talented over there. They've made a complete Horlicks of their GP service. So what are the solutions? The capacity-demand gap is now so big that we can only solve our problems using private providers. And I'm the BMA socialist who was against private healthcare for 40 years. We can only solve these problems now with private providers. The Sláinte Care programme is so successful that we need to promote cross-border services. We can't compete with Sláinte Care. We need to redefine what the NHS provides and stop pretending it will cover all universal needs. It won't. And we need to focus our energy and our resources on the most important areas, which are paediatrics, maternity, geriatrics, cancer services, ED, primary and community care. We know that every town hall will tell you those are the most important things. And the other thing, and I never thought I'd be up here saying this, is we need people to take out private health insurance if they can afford it, pay as you go if you can afford it, because every time you do that, you free up a space for someone who can't afford it. Seamus Heaney said there's no such thing as an innocent bystander, and yet many parts of our society are now bystanding in this disaster. And they're definitely not innocent, because the old, the vulnerable, the disadvantaged in our society are coming to harm and dying prematurely. We need change, we need it rapidly, but first and foremost we need the public and the politicians to recognise the dire situation that we're in. We're now experiencing huge numbers of avoidable deaths. We're going to see a decrease in life expectancy here in Northern Ireland, and we're going to see huge health inequalities. Just a final word on what the NHS means to us. The NHS is about more than healthcare. It's part of our social fabric. It's part of the glue that holds our society together. It's how we look after the vulnerable, the suffering and the dying. Failure to provide a high-quality health service will undermine confidence in our democratic society. The solution will require moral fortitude on the part of our politicians if they're to find a way through this, and they will need the support of the public to achieve this. Failure will result in the loss of this precious NHS, and replacing it will be both costly and difficult. Final word to Joni Mitchell: you don't know what you've got till it's gone. Thank you.